Outbreak. Thanks to Hollywood blockbusters, that word can send a shiver down anyone's spine. Most of us would think of diseases like Ebola and cholera in other parts of the world, but in fact, the United States often experiences outbreaks of potentially fatal diseases. What prevents such outbreaks from becoming contagions like we see in the movies? One major reason is a little-known government institution called the U.S. Public Health Service Commissioned Corps. One of the 7 uniformed federal services, the PHS Commissioned Corps is made up of 6,500 health and medical professionals embedded throughout nearly all government agencies, working on a daily basis to prevent the outbreak and spread of disease, and who can be deployed on short notice during a natural or man-made disaster or disease outbreak. Headed by the Surgeon General, they are a critical force responsible for protecting the health and safety of U.S. citizens.
The mission of the Public Health Service Commissioned Corps is to promote and protect and advance the public health of the United States. But that is a very narrow definition which doesn't do justice to the very broad and diverse mission and range of responsibilities that these officers have. They serve throughout the United States government in 28 different agencies and positions around the world. They fulfill a very important role that addresses the many diverse issues of public health with the expertise that they bring.
The PHS Commissioned Corps works with nearly all government agencies like the FDA, CDC, EPA, and FEMA, even the Department of Defense, on a daily basis to protect citizens from foodborne illnesses, infectious and chronic diseases, and environmental disasters. Like the National Guard, this elite team descends on the site of affected areas, providing health care and preventing the spread of disease. They are also deployed overseas to assist underserved nations facing health crises and work with legislators to create policies to better protect and promote public health.
Right now, at this very moment, we have officers in uniform who are serving in clinical jobs. They're seeing patients, whether it's dentistry patients, medical patients, psychiatry patients, mental health patients, in various settings. In addition, I have officers who are serving in the Department of Defense, specifically within the mental health initiative that's dealing with troops coming back both from Afghanistan and Iraq. We also have officers at this very minute who are serving overseas in positions in Africa, positions in Asia, who are monitoring diseases. They're looking at what's out there in order to ultimately help us here in the United States from having these diseases come to us.
While the overall federal response to Hurricane Katrina came under a lot of criticism, the PHS Commissioned Corps' role was generally praised as a prime example of how things should work. They not only provided emergency medical services to victims, they worked to prevent the spread of potentially deadly diseases.
When Hurricane Katrina hit in 2005, I think that all of us were initially shocked and then immediately went into action. The Commissioned Corps deployed almost 3,000 officers in the aftermath of Hurricane Katrina, and we were involved in a number of things. We set up and staffed a field hospital. We provided respite care. We provided care to the first responders. But mainly we were there to help the people of Louisiana who were so heavily impacted by Hurricane Katrina.
Public health is a matter of national security. The Public Health Service Commissioned Corps is the greatest defender of our nation's health and safety.
The fact is that in everyday life, behind the scenes, almost invisibly, the United States Public Health Service Commissioned Corps contributes to the health, safety, and security of the United States in many ways. We do it through our agencies like CDC, HRSA, SAMHSA, and NIH, and we also do it directly, supporting our military, working in embassies around the world, and working in some of the most remote locations around the world, including the Indian Health Service in the United States. So in short, we're a better nation, we're a stronger nation, we're a healthier nation because we have the United States Public Health Service Commissioned Corps.
The PHS employs the best and the brightest medical professionals who endure a rigorous screening process before they are commissioned. But in addition to the Corps' anonymity, there are other obstacles in the way of recruiting new members.
The Corps, as you may have already heard, is one of the best kept secrets of the United States. Hardly anybody knows who they are. So the first thing we need to do is to find a way to improve the marketing and informational outreach and communications for who these people are and how important they are to us in our daily lives. The second thing that needs to be done is to develop a more coherent and aggressive recruitment strategy. There is a tremendous need for public health service officers and public health service professionals not only around the country, but around the world. The final thing that needs to be done is in view of the high costs of education today, and these are all health professionals, so they're very highly educated individuals. Costs a lot to get them there. There is no way to compensate them for their education as a recruiting tool or incentive into the Public Health Service Commission Corps. So what we need is something like the Armed Services have in a Reserve Officer Training Course program where they pay tuition and give scholarships to individuals who then come and serve in uniform for however many years after they get their degree.
The thousands of medical professionals who make up the PHS Commissioned Corps are on the front lines of protecting our nation's greatest asset, our health. They need your support to continue their important work.
Our U.S. Public Health Service Commission Corps needs to continue to grow and be strengthened because there are so many gaps still in our health, safety, and security in the nation. The fact is, in global health today, there are many opportunities for us that we don't have a workforce large enough to deal with. The concept of health diplomacy, where we can take the best science and technology in public health and leverage it forward to create not only better health in developing communities around the world, but also to engender peace and prosperity where there is none.
People should support the Commission Corps first and foremost because we really are here with a mission that is to protect, promote, and advance the health of our nation.
People can help the Commission Corps by learning about us, supporting us, and we actually encourage people to join us as well. Whether you're a nurse, physician, environmental science person, we are all public health officials, and we're always looking for people to come and join us to support our ranks so that you can be involved in helping to ensure the public's health as well.
The PHS Commissioned Officers Foundation for the Advancement of Public Health exists to support the PHS Commissioned Corps by expanding the competencies and capabilities of Corps officers through efforts such as education, program development, and research into new public health practices. You can help. Please visit our website. The PHS Commissioned Officers Foundation needs the support of public health experts and benefactors such as you, as we continue our support for the PHS Commissioned Corps in its ability to find better means of protecting this nation's most important asset, the health of its people.